I am Dr. Prabhakar Shetty. You were watching me on Sify.com.
Doctor, what are the various causes that trigger asthma?
Every patient is unique in what triggers in him an asthmatic episode. Certain commonest causes are humidification in the air, environmental pollution. They can be exposure to dust. Some people react with triggers when they are exposed to pollen, which happens usually in the winter season. Along with this, cigarette smoking and any kind of smoke exposure which can be noxious to the lungs can trigger asthma. People are also known to have asthmatic episodes when they have episodes of heartburn or acidity. It usually is brought about by eating spicy food or a lack of exercise just before going to sleep. There are other also known causes like exercise, where there is an entity which is known as exercise-induced asthma, where patients get a trigger of asthma usually after exercising and it settles down after 20 to 50 minutes. Some patients, around 50% of them, might have a relapse of asthma after around 6 to 8 hours of exercise. These are the commonest triggers that we know of. There are uncommon triggers like certain foods which can trigger asthmas, like Ajinomoto in Chinese food. Certain people also get asthmatic triggers with shrimp and seafoods. These are the commonest known triggers that cause asthma.
What precautions can one take to reduce the risk of an asthma attack?
The commonest precaution to take is to follow your medication pattern regularly. There are good medications available for treatment of asthma. The thing to do is to get something that is called a lung function test, which tells you the severity of an asthma. Depending on that, your doctor will prescribe either medications as per need basis or regular medications. To follow that pattern of regular or as per need medications is very important. You can determine your severity of asthma at home by monitoring something that is called a peak flow meter, which tells you if your asthma is worse on certain days or something that has worsened your asthma, which gives you the independence of managing asthma on your own, which is basically the bottom line. Now we strongly propose patients to manage asthmatics or asthma triggers and exacerbations on their own, and only to see a doctor if it gets really severe. Following regular medications, knowing what your triggers are and avoiding those triggers, taking prompt treatment for simple upper respiratory tract infections would be the hallmarks of basically preventing asthma.
Any valuable tips for child asthma control?
Childhood asthma is an important aspect of asthma, which is usually overlooked because parents are scared of putting them on regular medications. But you have to understand a very important phenomenon, that it affects child growth more importantly. There is enough evidence and studies to show that asthmatics who are not treated properly have stunted physical and to a certain extent mental growth as well. It also affects the way they play sports, the way they sleep, the way they go about their daily activities. Important again here is to get him properly evaluated by a specialist, get his lung function test done regularly, and if need be, put him on regular medications. We've got to understand that a lot of children outgrow their asthma by their teenage years, because by that's the time by which immunity is completely developed. So be patient with treatment, put them on regular treatment, see your doctor on a regular basis, stick to a treatment plan, and that will surely help your child be more independent in managing his asthma and going about his daily activities and his daily sports.
When is a chest pain termed serious?
A serious chest pain is pain which is usually associated with sweating, associated with some elements of faster heart rate or something that we call palpitations and breathlessness. Most of the chest pains which are related to the heart have what we in medical terminology call radiation, which means the pain spreads either to your arm or up your jaw, or it can go to the back of your chest. These pains, which are usually left-sided, denote some evidence of a heart problem to your pain, which is the most serious kind of pain. It's important that when that happens, you should see your nearby doctor, the doctor who is available the closest at the earliest, better than going further away, so that you can get some prompt treatment. Other serious causes of pain can be because of lung ailments, which are usually because if you got fluid in the lungs, when you get pain when you breathe or cough. Pneumonias can give rise to pain, which are usually associated with fever and pain while coughing or when taking a deep breath. One of the other important reasons for pain, which you might say is not really serious but is important, is reflux acidity. A lot of people get pain because of acidity when the acid comes into your chest. And simple prompt treatments, even home remedies, will help you. But to stress on the fact that any pain which is left-sided, associated with sweating, breathing difficulties and with radiation, needs immediate and prompt